A hysterectomy is a surgical procedure to remove a woman's uterus. The uterus is where a baby grows during pregnancy. After a hysterectomy, a woman can no longer get pregnant. This is a big decision for women and their families. Hysterectomies are performed for a variety of reasons. Some women have heavy periods or pelvic pain that doesn't get better with other treatments. Others may have cancer of the uterus, ovaries, or cervix. There are different types of hysterectomies. The type of hysterectomy a woman has will depend on the reason for the surgery. It's important to talk to your doctor about all of your options and the risks and benefits of each procedure.
There are several types of hysterectomy procedures, each tailored to the specific needs of the patient. Understanding the differences can help women make informed decisions about their health. A total hysterectomy involves removing the entire uterus, including the cervix. This is the most common type of hysterectomy. A partial hysterectomy, also known as a supracervical hysterectomy, removes only the upper part of the uterus, leaving the cervix intact. A radical hysterectomy is a more extensive procedure that removes the uterus, cervix, surrounding tissues, and often the upper part of the vagina. This is typically done in cases of cervical or uterine cancer. The choice of which type of hysterectomy is appropriate depends on factors such as the reason for the surgery, the size and location of any abnormalities, and the patient's overall health.
Hysterectomy is a major surgical procedure with significant implications for a woman's reproductive health. Understanding the common reasons why this procedure might be recommended can provide clarity and alleviate anxieties. One of the most frequent reasons for a hysterectomy is the presence of uterine fibroids. These non-cancerous growths in the uterus can cause a range of symptoms, including heavy menstrual bleeding, pelvic pain, and bladder problems. Another common reason is endometriosis, a condition where tissue similar to the lining of the uterus grows outside of it, causing pain, irregular bleeding, and potential fertility issues. Gynecologic cancers, such as uterine, cervical, or ovarian cancer, often necessitate hysterectomy as part of the treatment plan. Other conditions, such as uterine prolapse, adenomyosis, and persistent abnormal vaginal bleeding, may also lead to a recommendation for hysterectomy. Section 4. Surgical approaches and recovery. The surgical approach for a hysterectomy can vary depending on factors such as the type of hysterectomy and the patient's overall health. Each approach has its own advantages and considerations. An abdominal hysterectomy involves making an incision in the lower abdomen. This approach is often preferred for larger uteruses or complex cases. A vaginal hysterectomy is performed through an incision made in the vagina. This approach typically results in a quicker recovery time and no visible scarring. A laparoscopic hysterectomy uses small incisions and a camera to guide the surgery. This approach often leads to faster recovery and minimal scarring. Recovery time can vary, but generally involves a few days in the hospital and several weeks at home.
For many women, undergoing a hysterectomy marks a significant life change. Sharing real-life stories can provide support, insight, and a sense of community for those navigating this experience. Sarah, a 45-year-old mother of 2, had been struggling with heavy menstrual bleeding and debilitating pain for years due to uterine fibroids. After exhausting other treatment options, she decided to undergo a hysterectomy. I was initially apprehensive about the surgery, she shares, but the relief I felt afterward was immeasurable. I finally had my life back.
Similarly, Jennifer, a 52-year-old woman who underwent a hysterectomy for endometriosis, expresses gratitude for the positive impact the surgery had on her quality of life. The chronic pain and fatigue I had been enduring for so long finally subsided, she says. I have more energy now than I have in years.
These stories highlight the transformative potential of hysterectomy for women who have been living with debilitating gynecological conditions. While the decision to undergo such a significant surgery is deeply personal, hearing from others who have gone through similar experiences can provide comfort and reassurance.
Section 6. The vital role of nurses. Nurses play a crucial role in the care of hysterectomy patients, providing support, education, and compassionate care. Their expertise ensures optimal outcomes and a positive patient experience. Before surgery, nurses educate patients, answer questions, and address concerns. They provide preoperative instructions and emotional support. After surgery, nurses monitor vital signs, manage pain, and assist with mobility.
Nurses advocate for patients, ensuring their needs are met and voices heard. Their compassion and expertise make a profound difference in patients'